friends, my name is Anjali Shrivastava and welcome to my YouTube channel My Life Steps. Today we are going to discuss regarding one of the important topic which is considered as pre-eclampsia. So beginning with the introduction of pre-eclampsia. So pre-eclampsia is a condition which only happens in case of pregnant women. It occurs after 20 weeks of gestation or sometimes it occurs up to 6 weeks after delivery also. So what it is basically the new onset of, which is not there present before. It is the new onset of hypertension along with proteinuria. Proteinuria is presence of protein in urine, which is an indicative marker that it is damaging kidney. And along with the kidney damage, there are many organs which are being damaged in case of pre-eclampsia is like retina, our liver, brain, etc. In some patients, the sign and symptoms of pre-eclampsia is very mild, but in case of severe conditions, the severe sign and symptoms can be seen, which is a life-threatening also. In some women, when pre-eclampsia is combined with seizures, it is considered as eclampsia, which is very important. Just keep in mind, when pre-eclampsia is combined with seizures, it is considered as eclampsia. Now we are going to discuss who all are prone of getting this pre-eclampsia or what are the risk factors of pre-eclampsia. First, the mothers who are having the first pregnancy, that is the primary mothers. Then mothers with multiple gestation, mothers who are more than 35 years of age, that is elderly pregnancy, the people who are having hypertension before, the mothers with obesity, and the family history. Family history means if the people are having pre-eclampsia or eclampsia in their family history, so those people are the people who are prone of getting this pre-eclampsia. Further in this video, we are going to discuss regarding pathophysiology. Pathophysiology means what is basically occurring inside the body which results in pre-eclampsia. Basically, it is due to the development of abnormal placenta. Placenta is what? It is the connection between the fetus and the mother. So what is happening during the normal pregnancy, the spiral arteries of the uterus gets dilated 5 to 10 times, which results in the further formation of uteroplacental arteries. Uteroplacental arteries are the arteries which are basically responsible for supplying the blood towards the placenta so that it can provide the blood supply to the growing fetus. But in case of pre-eclampsia, what it is happening, that uteroplacental arteries which are going to develop is developing as a fibrous arteries. Fibrous as well as these arteries becomes narrow in case of pre-eclampsia. Due to the narrowing of the arteries, there is a very less blood supply which is going towards the placenta. So these poorly perfused placenta which results in the IUGR. First, IUGR is what? Intrauterine growth retardation, and it may also results in fetal death. So and there is one more thing which is happening is this poorly perfused placenta starts releasing pro-inflammatory protein, and these pro-inflammatory proteins are the proteins which are directly going towards the maternal circulation. And what they are doing inside the maternal circulation is that they are damaging the endothelial cells and results in the dysfunctioning of it. So that dysfunction results in the constriction of the arteries and veins first, and then also results in the dysfunction of kidney. So kidney dysfunction takes place in such a way that it starts retaining the salt inside it and start retaining the salt. So retention of the salts ultimately results in hypertension. So that is what hypertension, that is one of the classical sign of pre-eclampsia. Further, moving towards the diagnosis or seeing for the sign and symptoms that are basically making us to understand that this is pre-eclampsia. So as we have discussed, there is hypertension. So in case of pre-eclampsia, hypertension is defined as the systolic blood pressure which is equal to or more than 140 millimeter of mercury, and diastolic pressure is equal to or more than 90 millimeter of mercury. In severe cases, there is systolic pressure which is more than or equal to 160 millimeter of mercury, and diastolic pressure is equal to or more than 110 millimeter of mercury. So what is happening, these extremely increased diastolic and systolic pressure is ultimately results in hemorrhagic stroke, and sometimes it also results in abruptio placenta. Abruptio placenta is the placenta detaches prematurely from the uterus, and it may also call some kind of local vasospasm. Vasospasm means there will be again the vasospasm means again there will be less blood supply to certain organs. As we have discussed, if there is less blood supply to the kidney area, it is again resulting in different sign and symptoms including oliguria. Oliguria is the decrease of the urine amount which is normal, which is less than normal. Then we have proteinuria, which is a classical sign of pre-eclampsia. When there is decreased blood supply to different organs including retina, then we have the blood vision, then we have the sensation of the flashing lights, etc. Sometimes there is reduced blood supply to the liver area also, which may cause severe liver injuries and which also results in swelling of the liver. And that also sometimes that swelling of the liver results in the upper quadrant pain which is resulting into the pain in the upper quadrant area in the epigastric region. It is one of the classical sign of severe pre-eclampsia. So what is the classical sign of severe pre-eclampsia is when there is reduced blood supply to the liver, there is a epigastric and the upper quadrant pain, due to which it results in the further damaging of the liver. So this is one of the classical sign of severe preeclampsia. Further discussing about what is HELP syndrome. HELP syndrome is a kind of a clinical sign. We can say that it is a kind of a acronym to remember few things. So HELP means HELLP. We will discuss what it is first. As we have discussed, there is a damaging of the endothelial cell. So that results in the sometimes that damaging of endothelial cell results in the formation of thrombus formation inside the blood vessels. So these thrombus in the blood vessels is like a stone which is in between the river, which is a RBC river which is flowing through. So sometimes due to that thrombus, and main important thing is when there is this kind of thrombus formation is taking place, so there is more utilization of platelets that results in the depletion of these platelets. And then these thrombus formation is coming in between inside the blood vessels. When the RBCs are crossing these blood vessel area, these are coming in contact with that thrombus, and it results in the destruction of that RBC, that is also considered as hemolysis. So altogether these processes results in the HELP syndrome. H for hemolysis, E for elevated, L for liver enzymes, then L for low, and P for platelet. So hemolysis, elevated liver enzymes, low platelet. So these are the sign and symptoms which is basically seen in most of the severe cases of preeclampsia, and it is basically seen in 10 to 20% of the women. So this is what the HELP syndrome means. Again, there is one more thing to discuss, and one of the sign which is commonly seen is the generalized edema, generalized body edema. How it is taking place? It is again due to the damaging of the endothelial cells, which results in the increasing of the vascular permeability. When this vascular permeability is being increased, the water slips from the blood vessels to the tissue area. So basically the water permeability of the blood cells or the wall is increasing, so water is crossing that wall and going towards the tissue area, which results into the generalized body edema, which is basically seen in the legs, face and the hands area. Then we have the pulmonary edema, which results in coughing, shortness of breath, etc. Then we have cerebral edema, which results in headache, confusion, seizures, and we have already discussed in the beginning, if seizure is combining with pre-eclampsia, it results in eclampsia. Then there is something very less to discuss regarding what is the basically the treatment of pre-eclampsia. So when we have to make the patient to get treated with pre-eclampsia is simple is that we have to deliver that fetus as well as placenta for getting relief from this pre-eclampsia. For deciding for this delivery of fetus and placenta in case of pre-eclampsia, it is very important to see for the gestational age of the fetus, and you have to go for checking the severity of the disease, whether it is hampering the mother, whether it is hampering fetus or not. These all things we have to keep in mind. And additional measures are the medications and the supplemental oxygen that we can provide. So in detail we are going to discuss regarding the treatment in the further videos. This much for today. Thank you very much.